goodness. What do we do with families? It's very broad, because we are certainly available to offer support to families. And obviously we do have specific training that is helpful with that. Specific training working with people who have had, life events that were unanticipated, that have been, quite devastating for a family system. But what we don't want to do is sort of foist ourselves on families, because some families are at this stage in the journey wanting to focus very much on the patient and the practicalities, and so we wouldn't want them to feel compelled to talk to a psychologist. I think one of the challenges that we have is that, you've done some really good work about the way that families can feel pathologized by the system. And, one of my worries sometimes is that I think that when families hear the words, do you want to speak to a psychologist, or, our psychologist is available, that they may interpret that as the team thinking there's something wrong with them, that they have a problem that needs fixing. And of course, we don't see it like that at all. What we see it as is, nobody would want their relative to have to come to our service. That is a sad fact of life, and we're all aware of that. It's a very, very complex thing to have to deal with. The medical information is, quite hard sometimes to get one's head around, even if you're an experienced team member, let alone a family member. Every family obviously comes in wanting the best for their person, and for some people they're going to show significant improvement and others they're not. So families are going to have different things to be dealing with. It would be astounding if this wasn't a difficult and challenging time for people. So we want them to know that we are available, and we're not here to diagnose them. We're not here to tell them that anything that they're doing is wrong, because I don't think there is a wrong in this circumstance. It's more to think about, is there anything we can offer that will make this situation even just a tiny bit easier today than it was yesterday? And I think that that's the message we would want to give. And of course, sometimes people have a lot of support in their own social networks. They've got support coming out their ears. What they want from us is to look after their patients and to do the best that we can. And obviously, we respect that too. Right.
What can you do as
Yes.
a clinical psychologist for a family in their time when you're talking with them? What are you trying to tease out? What are you trying to convey? What are you trying to hear?
Right. Well, I think the first thing is, if they want to sit down with us, then it's because they want somebody to listen to their story. And I think, first and foremost, that's what we're doing. We're there to be the people who are taught how to listen, and to make those judgments on when you might offer a little bit of advice, or when you might empathise, when you might sort of even throw in a little bit of theory and explain to them that that everything they've just described actually isn't that uncommon. And I think sometimes that sort of normalising element, and helping them have a framework to see, particularly when people are finding they're swinging from one emotion to the other, that's quite common. That sometimes it can feel like they've got infinite hope, and they're charging into battle, and it's all going to be wonderful and everything's going to be fantastic, and then 2 hours later it's terrible, it's devastating, and they wish they'd never happened. They think their relative would be better off dead, and then they feel terrible about thinking that, and then they put their hope armour back on again, and just really sort of saying to them, you are not the first person to have felt like this, you won't be the last, you're not alone. So those sorts of sort of gentle strategies.